Ladies, let's face it, if you don't tell your man to go to the doctor, they probably never will.
But early detection could mean the difference between life and death when it comes to breast cancer, and thousands of men will be diagnosed with it this year alone. We brought in Dr. Putao Cen. She is a medical oncologist with UT Health and Memorial Hermann Texas Medical Center to share with us some of the signs and symptoms that women should watch for it in an effort to help their men and the ones who they love. Doctor, welcome. Good morning to you.
Thank you very much.
Well, let's start off with just talking about how common breast cancer is in males.
So around 1 in 1,000 male can develop breast cancer. And in United States, annually, it will be 2,400 cases a year. And it like compared to women, it's 1 in 8 women will diagnose with breast cancer. In men, it's 1 in 1,000.
Wow. And what causes it?
So there's a multiple factor. Number one is aging, because it's an acquired DNA mutation. That means when every day we have a cell dividing and replicate the DNA, and during the replication of the DNA, it will make mistake. So when we get older, the mistake will accumulate it. So the older age, number one. Number two is elevation of the estrogen to testosterone ratio. So more estrogen in your body will increase your risk to getting breast cancer. And number three is a family history. There's 20% of the male breast cancer will have a positive family history. But on the flip side, is 80% of male diagnosed with breast cancer without family history.
Oh, wow. Oh, wow. Well, doctor, so for women, we constantly say early detection is key and it can save lives. What about for men? What are some of the warning signs and symptoms?
Yeah, so the warning sign, number one, is a painless, swollen, or lump of the breast. Number two, it could be a dimple on the skin. And number three would be retraction of the nipple or discharge from the nipple. Or and the following could be scaling of the skin or redness on the skin around the breast.
Yeah, I was just going to ask, so what kind of treatment available? Like, what are the options there?
Yeah, so men breast cancer a little bit different from women. It's 90% of the time it's invasive. Breast cancer. Invasive, that means there's potential to spread to a distant part of the outer organ or part of the body, so need to early diagnosis. And number two, different is 90% of the time is estrogen receptor positive. That means the breast cancer tissue in men can grow under estrogen. So the treatment will be a surgery, number one, and then it could be a chemotherapy, and most important, if it's 90% of the estrogen positive, they need to take tamoxifen, which is estrogen inhibitor.
Wow. Well, early detection and certainly knowing your body is key. Doctor, thank you so much for coming in. A very important conversation. I think the takeaway for women is if you notice something different,
yes,
say something and get it checked out.
Because and it doesn't discriminate, right? For men too. Yeah, thank you so much.
Doctor.
Thank you.